Health Matters is sponsored by Bon Secours.
Bon Secours is using advanced cardiac technology called the left ventricular assist device, or LVAD. It's surgically implanted into heart failure patients to help the heart pump more blood with less work. Joining me now is Dr. Katherine Lietz of the Advanced Heart Failure Center here at Bon Secours St. Mary's Hospital. Dr. Lietz, first tell us, how does the LVAD work?
Well, here is an example of an LVAD, left ventricular assist device. As you can see, this is a very small pump. It is placed on the tip of the left ventricle, and what it does is drains blood from the left ventricle, propels it into the ascending aorta, and thereby it bypasses your heart and treats it as if it was a passive conduit. It works together in tandem with your heart to produce normal cardiac output.
And what patients are good candidates for the LVAD?
Well, typically patients that are good candidates for LVAD are those who have very advanced heart failure with really severe symptoms such as severe shortness of breath, fatigue, who cannot tolerate their medications anymore because of hypotension. Perhaps they have organ damage, kidney dysfunction. Those patients typically have limited prognosis, perhaps 6 months, less than a year, and those would benefit the most from this kind of treatment.
Thank you so much, Dr. Lietz. If you want more information, just go to bonsecours.com/Richmond.